Introducing Foxseal Vented Chest Seal, the next generation vented chest seal designed to offer the very best chances of saving lives from open chest wounds. Pneumothorax is reported as the most common injury sustained in chest trauma, occurring in about 20% of patients. Pneumothorax is defined as the presence of air or gas in the pleural cavity. When air enters the chest from outside the body through a penetrating chest injury, it develops pressure. This is called tension, and if left trapped inside, can lead to the collapse of the lung. According to TCCC guidelines, all open and/or sucking chest wounds should be treated by immediately applying a vented chest seal to cover the defect. Foxseal Vented works by allowing trapped air to escape through a central soft valve and a smart radial venting system with the highest number of vents in the market. The venting system consists of 3 circles with 8 vents on each circle and a total of 512 venting pathways for the air to escape, minimizing the risk of blockage and preventing the development of tension pneumothorax. Fast and effective treatment is needed to save lives. The following training video is a guide to using Foxseal Vented according to the product's indications and packaging instructions. When responding to a casualty, it's important to identify the signs of a life-threatening chest injury. These could involve sucking or hissing noises coming from chest wound, frothy blood coming from the chest wound, casualty coughing up blood, shortness of breath or difficulty in breathing, unequal chest movement. In severe cases, there may be deviation of the trachea. Foxseal Vented is designed to offer the very best chances of saving lives from open chest wounds. Wear gloves if available. Fully expose the wound. Wipe dirt or fluid from the skin around the wound. Familiarize yourself with the product's packaging. It has 4 tear notches, 1 at each corner. Once the wound has been exposed and you have wiped the surrounding skin, open the pack and remove the Foxseal Vented chest dressing from the packaging. Grip the protruding tab and peel back to remove the Foxseal Vented dressing away from the clear liner. This will expose the adhesive side to the dressing. Be careful not to touch the adhesive side, as this has a strong sticky nature. Place the dressing onto the wound, centering the soft valve in the middle of the dressing over the wound. Place this adhesive side down. Key to treatment is to seal the hole or holes, thereby preventing air entering the chest cavity, thus allowing the lung to once more inflate. Firmly press the dressing down onto the skin around the wound to seal. It is important to continue to assess the casualty and monitor action of the chest seal. Monitor the casualty for the potential development of a subsequent tension pneumothorax. If the casualty develops increasing hypoxia, respiratory distress, or hypotension, and a tension pneumothorax is suspected, treat by burping or removing the dressing, needle decompression or finger thoracostomy. Use an additional dressing for each additional chest wound. Additional dressing does not need to be vented unless that is the only dressing available. A manual occlusive dressing will suffice. Transfer the casualty to the next stage of care. Foxseal Vented is a unique 360-degree hypervent system and the first ever chest seal with 512 venting pathways, giving you more ways to release pressure, prevent blockages, and save a life. Remember to follow these steps when applying Foxseal Vented. Wear gloves if available. Expose the wound. Wipe dirt and fluid from skin around the wound. Tear open pack and remove Foxseal Vented. Grip tab and peel to remove Foxseal Vented from clear liner to expose the adhesive side. Place dressing centered on the wound, adhesive side down. Firmly press dressing to skin around wound to seal. Continue to assess casualty and monitor action of chest seal. Use tab to vent and reseal if required. Use an additional dressing for each additional chest wound. Additional dressing does not need to be vented unless that is the only dressing available. A manual occlusive dressing will suffice. Designed for military operations, Foxseal Vented is the next-generation chest seal that offers a unique 360-degree hypervent system, 512 venting pathways, fast application in any orientation, effective vent performance even if creased, solid adhesion, proven in extreme conditions, reseal tab to enable life-saving rapid decompression. Foxseal Vented Chest Seal, the next-generation vented chest seal designed to offer the very best chances of saving lives from open chest wounds. Made to save lives.